You worked your entire life for retirement, and now that you're here, or close to it, something doesn't feel right. You're more tired than you expected, more anxious. Maybe your blood pressure is creeping up, your joints ache more than they did at 60, and your doctor keeps adjusting your medications without a clean explanation. You followed all the rules. You earned this. So why does your body feel like it's falling apart at the exact moment it was supposed to rest? I'm Dr. Nathan Wells, a board-certified internal medicine physician with over 20 years of clinical practice focused entirely on adults over 50. I have sat across from hundreds of patients in the months after retirement, and I keep hearing the same version of the same story. And for years, I didn't have a satisfying answer for them. The research does now. Retirement, especially the first 2 years of it, triggers a cascade of biological and psychological changes that most physicians don't warn their patients about, and some of those changes carry real clinical consequences. A study published in the Journal of Economic Perspectives, tracking more than 12,000 adults over a 15-year period, found that retirement increases the probability of clinical depression by 40% and the probability of a diagnosed physical illness by 60%. That is not a small finding. 60%. That means retirement itself, the event your body has been waiting for, can be a significant health risk if you don't understand what it does to your physiology. Today, I'm going to walk you through 6 specific changes that happen inside the body and brain when you stop working. 6. I'll explain exactly why each one happens, what it feels like from the inside, and what you can concretely do about each one. I'm not going to tell you retirement is dangerous and leave you there. That's not how I practice medicine. But I need to tell you the truth first, and the truth is more specific than most people expect. And I want to flag something before we get into the first change. There is one biological mechanism I'll explain near the end, change number 6, that reverses almost everything on this list at once. Most people have no idea it exists. Stay with me for that. If you've already noticed some of these changes in yourself, or you watch someone you love retire and seem to age faster than expected, leave a comment below. Tell me what you saw. Your experience is useful to other people watching this right now. Before we go further, everything I share here is medical education, not a diagnosis. Your own physician knows your full history, your medications, and your specific situation in ways no video ever can. Use this to start a better conversation with your doctor, not to replace one. Change number 1. Retirement dismantles your body's internal clock, and it does it faster than most people anticipate. Your circadian rhythm is the biological timekeeper that governs your sleep cycles, your cortisol patterns, your immune response, even your body temperature throughout the day. Think of it like the electrical grid of a house. When the power runs on a predictable schedule, every appliance operates correctly. Retirement removes the external schedule that your body has been calibrated to for 30 or 40 years, and your internal clock does not automatically rebuild itself. It drifts. I had a patient, I'll call her Margaret, she was 71, who retired from a career in hospital administration and came back to see me 4 months later complaining of fatigue so severe she'd stopped her morning walks. She thought something was wrong with her heart. We ran the full workup. Everything came back normal. When I asked about her daily schedule, she paused. "I don't really have one anymore," she said. That pause told me everything I needed to know. Margaret wasn't sick in the way she feared. Her cortisol, the hormone that governs morning alertness and energy, had shifted its release pattern because her wake time had drifted by 2 hours over 4 months. Her body was producing cortisol at 10 in the morning instead of 6:30, which left her foggy and flat during the hours she'd previously been sharpest. Small shift, enormous consequence. We rebuilt her morning anchor, consistent wake time, natural light exposure within 20 minutes of getting up, and her energy returned within 6 weeks. Same body, different schedule, completely different outcome. The NIH has documented that irregular cortisol patterns in adults over 60 are associated with accelerated cognitive decline, impaired glucose regulation, and increased systemic inflammation. When retirement dissolves your schedule, cortisol dysregulation is the first domino to fall, and the ones that follow it are serious. Which brings me to change number 2. The second change retirement triggers is the loss of what neuroscientists call passive cognitive load, and this one is genuinely underappreciated in clinical medicine, including by many physicians who should know better. Passive cognitive load is the low-level mental activity your brain performs automatically throughout a working day, navigating office dynamics, tracking overlapping deadlines, solving small logistical problems, making dozens of micro-decisions before noon. It is cognitive exercise you did not know you were getting. Retirement removes it almost entirely, often within the first week. The brain is like a pipe that carries water every day for 40 years. When you shut the water off, the pipe doesn't stay strong. It calcifies, it narrows, it loses the capacity it maintained through constant use. The research from the Rush Memory and Aging Project, a longitudinal study that followed more than 1,900 adults over multiple decades, found that lower levels of daily purpose-driven cognitive activity were one of the strongest predictors of Alzheimer's-type cognitive decline, independent of education level and independent of genetics. That second independence matters enormously. It means the protection isn't something you were born with or without. It's something you either maintain or you don't. I want to be careful here. I am not saying retirement causes Alzheimer's disease. What the research tells us is that abrupt removal of structured cognitive challenge accelerates the timeline for people already on a trajectory toward decline. And since most of us don't know whether we're on that trajectory, the protective behavior is the same regardless. A patient I'll call Robert, 74, retired from 30 years as a civil engineer, sharp, curious, engaged. His wife called my office 8 months after he retired, not because he was visibly impaired, but because she'd noticed he'd started losing the thread of conversations mid-sentence. Robert brushed it off as tiredness. His wife was right to be concerned. When I assessed him, his word retrieval had measurably slowed, and his processing speed had dropped. Not dementia, not even mild cognitive impairment by clinical criteria, but a real, detectable decline in 8 months. We enrolled him in a structured volunteer program, got him back to doing structural calculations as a hobby, involved him in a weekly chess group. 2 years later, his processing scores had returned to baseline. The brain responded to the demand. It needed to be asked something. If you retired in the last 1 to 2 years, I want you to hear this not as a warning, but as a call to action. The window to protect your cognitive reserve is open right now. Don't wait for a symptom to act. Change number 3 is the one that surprises most of my patients the most because it has nothing to do with their health habits. Here's what almost all retirement advice misses. The social structure of work, the irritating colleague, the obligatory meeting, the lunch you had every Thursday without planning it, was protecting your health in ways you couldn't see from the inside. When it disappeared, so did something your body was depending on. Loneliness is not a mood. Researchers at Brigham Young University analyzed data from more than 300,000 adults and found that social isolation increases mortality risk by 26%, a number they compared, in their analysis, to smoking 15 cigarettes a day. Retirement doesn't make you lonely automatically, but it removes the involuntary social contact that many adults quietly relied on for decades without realizing it. When work ends, so does the structure of belonging, and no one warned you to replace it deliberately. Chronic social isolation elevates circulating levels of interleukin-6 and C-reactive protein, 2 inflammatory markers that the AHA directly links to increased cardiovascular risk. The loneliness isn't just emotionally painful, it's measurable in your blood work. It shows up on a lab report. The fix isn't forced socializing. It's finding regular structured contact where your presence has stakes. Not a party. A commitment where someone notices if you don't show up. We are halfway through the 6 changes. If this is resonating, if you've been nodding along because you've lived some version of this, I'd ask you to share this video with someone who retired in the last year or 2. The second half is where we start talking about what actually reverses this. They need to hear it. Change number 4 is the one that generates the most resistance in my exam room. I call it identity collapse, though the clinical literature frames it as role discontinuity. For most adults over 50, work was not just what they did. It was the answer to, "Who are you?" When that answer disappears, the nervous system registers it as a genuine threat, not metaphorically, but neurologically. The anterior cingulate cortex, the region that processes social pain and identity threat, responds to role loss in ways that are neurologically similar to physical pain. Research published in Psychological Science confirmed that people who experience sudden loss of a core identity role show elevated stress hormone profiles, disrupted sleep architecture, and significantly higher rates of cardiovascular events in the 12 months following that loss. The same 12 months most people describe as the adjustment period. They're not wrong that something is being adjusted. They're wrong about what. A patient I'll call Carol, 66, was a nurse practitioner for 38 years. She was admired. She mattered to people in a concrete, daily way. She retired on a Friday, took a planned vacation, came back feeling rested, and then told me 3 months later that she felt invisible. That was the exact word she used. Her blood pressure, well controlled for years on a single medication, had climbed 15 points. She was sleeping 6 hours a night instead of her usual 7.5. Carol wasn't grieving a job. She was grieving an identity, and her cardiovascular system was bearing the weight of it. What Carol needed, and what I've learned to prescribe as deliberately as any medication, was a replacement identity with social stakes attached. Not a hobby, a role, something where other people depended on her showing up. She began volunteering at a nursing home 2 days a week, teaching medication management to caregivers. Within 4 months, her blood pressure returned to its previous range without any medication change. Her sleep stabilized. The role gave her nervous system the signal it had been missing. You are still someone. You still matter. That signal is not optional for the aging body. It is biological fuel. Change number 5 is one retirement accelerates, but that most people blame entirely on age. Musculoskeletal deconditioning. When you were working, you moved. Maybe not dramatically, maybe not in ways that felt like exercise, but you walked to meetings, climbed stairs, carried bags, stood at a counter, shifted positions a dozen times before lunch. You were accumulating what exercise physiologists call non-exercise activity thermogenesis, or NEAT, without counting a single step. Retirement can slash NEAT by 30 to 50% in the first year for adults who don't replace it intentionally. The consequence isn't just weight gain. The CDC's physical activity guidelines specifically note that reductions in daily movement accelerate loss of lean muscle mass, a condition called sarcopenia, which directly degrades balance, glucose metabolism, and bone density at the same time. One change. 4 simultaneous downstream effects. Sarcopenia progresses at roughly 1 to 2% of muscle mass per year after 50 in sedentary adults, but that rate accelerates sharply with sudden inactivity. When a patient tells me their knees started hurting after retirement, or that they feel physically weaker than they did at 65, the instinct is to blame age. Age is always a factor, but the sudden drop in daily movement is often the larger driver, and unlike age, movement is something you can change this week. A consistent 30-minute morning walk, 2 sessions of simple resistance work per week, body weight, bands, whatever you'll actually do, and a habit of standing while you read or watch television recreates enough physical demand to meaningfully slow that curve. The Cleveland Clinic's research on adults over 65 shows that 150 minutes of moderate weekly activity reduces all-cause mortality risk by 31%. The bar is genuinely lower than most people assume. And now, change number 6, the one I promised you at the beginning, the one that connects back to almost everything else on this list. Most people expect sleep to improve after retirement. More time, less pressure, no alarm clock pulling you out of bed before you're ready. For the majority of my patients, the opposite happens, and the reason why explains something fundamental about how the aging body actually works. Sleep architecture in adults over 60 is already shifting toward lighter sleep stages and earlier natural wake times. This is normal aging physiology, and it's largely unavoidable. But here's what most people don't know. Work was partially compensating for that shift. The longer you stayed awake and cognitively engaged throughout a working day, the more adenosine, a sleep pressure chemical, accumulated in your brain, creating the biological drive that pulled you into deep sleep at night. Retirement reduces cognitive demand, reduces adenosine buildup, and weakens that drive. You nap in the afternoon because you're understimulated. You lie in bed later in the morning. You shorten your time awake, and your sleep drive weakens in direct proportion. The result is fragmented nights, very early waking, and the exhausting paradox of spending more time in bed while sleeping less deeply than you ever have. A 2020 study in Sleep Medicine Reviews found that retirement independently increased reported insomnia symptoms by 34%, even after controlling for health status and depression. That held across countries and income levels. Sleep problems after retirement are not a personal failure or a sign of anxiety disorder. They are a predictable biological consequence. And here's the part that matters. They respond to the exact same interventions as every other change on this list. Consistent wake time, morning light exposure, daily movement, purposeful cognitive engagement, a social role with real stakes. These are not 6 different prescriptions for 6 different problems. They are one prescription, expressed 6 different ways, because retirement created one central disruption: the removal of structure from a body that ran on structure for 4 decades. The patients I've watched thrive after retirement are not healthier by luck or by genetics. They are healthier because they understood, either intuitively or because someone told them, that retirement removed an invisible scaffold and that their only job was to build a visible one, not the same scaffold, their own. The retired school teacher who now tutors 2 afternoons a week. The former accountant who joined a woodworking class and meets every Saturday. The retired physician, actually, who records videos for the people she used to see in her office. I know that last one personally. None of them are grinding. None of them feel like they're working. They feel like themselves again, because they gave their nervous systems the inputs those systems were built to receive. Retirement is not a trap. Used correctly, it is the first time in your adult life that you get to design your own structure entirely on your own terms. You get to choose what challenges your mind, what moves your body, what gives you a role, and who depends on you being present. That is not a burden. It is the most significant degree of freedom most people ever have. And your biology, it turns out, is completely prepared to meet it. I'm Dr. Nathan Wells. Stay aware, stay proactive, and take care of yourself. I'll see you in the next one.